What if I told you that right now, sitting in your medicine cabinet, there's a pill you take every day that could be slowly weakening the very organ that keeps you alive? A medication so common, so trusted, that millions of people over 50 take it without ever questioning its impact on their heart. I'm talking about a class of drugs that, while solving one problem, might be creating a much more serious one. My name is Dr. Fernando Manocchi, and for over 15 years, I've stood in operating rooms, holding human hearts in my hands. I've seen what happens when these incredible organs fail, and I've also witnessed the remarkable resilience they show when we give them what they need to thrive. Today, I need to share something with you that could change how you think about a medication you might be taking right now. Let me paint you a picture. Imagine your heart as the engine of a car that's been running perfectly for decades. This engine doesn't get to rest, doesn't get weekends off, doesn't take vacation days. It beats roughly 100,000 times every single day, pumping about 2,000 gallons of blood through your body. Now imagine someone told you there was a fuel additive that might make your engine run a little smoother in one area, but over time, it could be causing microscopic damage to the engine itself. Would you want to know about it? That's exactly what we're dealing with when we talk about proton pump inhibitors, or PPIs. These are medications like omeprazole, esomeprazole, lansoprazole, and pantoprazole. You might know them by brand names, but what matters is what they do, and what they might be doing to your heart, without you realizing it. Here's what makes this situation so concerning. PPIs are among the most prescribed medications in the world. In the United States alone, more than 15 million people take them regularly, and the majority are over 50. They're designed to reduce stomach acid production, which can provide tremendous relief for people dealing with acid reflux, heartburn, or stomach ulcers. The problem is, these medications were originally intended for short-term use, typically 8 to 12 weeks, yet studies show that up to 70% of people taking PPIs have been on them for more than a year, and many for several years. Think of your stomach acid like the security system in your home. It's there for a reason, protecting you from harmful bacteria and helping you absorb essential nutrients. When we suppress this natural defense mechanism for extended periods, we create a cascade of effects throughout the body, and your heart becomes an innocent bystander caught in the crossfire. The connection between PPIs and heart health isn't immediately obvious, which is what makes it so dangerous. Unlike a medication that might cause obvious side effects, like nausea or dizziness, the impact on your heart happens silently, gradually, over months and years. It's like termites slowly eating away at the foundation of your house. You don't notice anything wrong, until one day there's structural damage that could have been prevented. Recent research has uncovered several mechanisms by which long-term PPI use could be associated with increased cardiovascular risk. The first involves something called endothelial dysfunction. The endothelium is the thin layer of cells that lines your blood vessels, like the smooth interior coating of a garden hose. When this lining becomes damaged or doesn't function properly, it can lead to inflammation, reduced blood flow, and an increased risk of blood clots. Studies suggest that PPIs might interfere with the production of nitric oxide, a molecule that helps keep your blood vessels flexible and healthy. When nitric oxide levels drop, your blood vessels become stiffer, your blood pressure may rise, and your heart has to work harder to pump blood throughout your body. It's like trying to push water through a hose that's become rigid instead of flexible. But that's not all. PPIs can also affect your body's ability to absorb crucial nutrients that your heart depends on. Magnesium, for instance, is essential for proper heart rhythm. When stomach acid is suppressed for long periods, magnesium absorption can decrease significantly. Low magnesium levels have been associated with irregular heartbeats, muscle weakness, and increased risk of sudden cardiac events. Vitamin B12 is another critical nutrient that requires adequate stomach acid for proper absorption. B12 deficiency can lead to elevated levels of homocysteine, an amino acid that, when present in high concentrations, has been linked to increased risk of heart disease and stroke. Think of homocysteine as rust forming in your cardiovascular system, gradually weakening the very pipes that carry your life force. Let me share a story that illustrates this perfectly. I had a patient, let's call him Robert, a 67-year-old retired teacher who came to see me complaining of fatigue and occasional chest discomfort. During our consultation, I learned that Robert had been taking a PPI for acid reflux for over 3 years. His primary care doctor had prescribed it, and it worked so well for his heartburn that he never questioned continuing it. When we ran blood tests, Robert's magnesium levels were below normal, and his B12 was borderline low. His EKG showed some irregularities that weren't life-threatening, but weren't normal either. After discussing with his gastroenterologist and gradually weaning him off the PPI, while addressing his acid reflux through dietary changes and alternative approaches, Robert's energy improved, his heart rhythm normalized, and his nutrient levels returned to healthy ranges. Now, I want to be absolutely clear about something. I'm not suggesting that everyone should immediately stop taking their PPI. These medications can be life-saving for people with serious conditions like severe acid reflux disease or stomach ulcers. What I am suggesting is that if you've been taking a PPI for months or years, it's worth having a conversation with your doctor about whether you still need it and whether there might be safer alternatives for your particular situation. The challenge is that many people don't even realize they're taking a PPI long-term. It becomes part of their daily routine, like brushing their teeth or taking a multivitamin. They might have started taking it for a specific episode of heartburn or acid reflux, found relief, and simply continued without reassessing whether it's still necessary. This is where the concept of medication review becomes crucial. Think of it like getting your car serviced regularly. You wouldn't drive the same car for years without ever checking the oil, rotating the tires, or assessing whether all the systems are functioning properly. Your medication regimen deserves the same attention. Research published in major medical journals has shown some concerning associations between long-term PPI use and cardiovascular events. One large study involving over 16 million people found that those taking PPIs had a 16% to 21% increased risk of heart attack compared to those not taking these medications. Another study suggested a possible link between PPI use and increased risk of stroke. But here's what I find most troubling as a heart surgeon. Many of these risks could potentially be reduced with proper monitoring, regular reassessment, and exploring alternative approaches when appropriate. The tragedy isn't that PPIs exist or that they're prescribed. The tragedy is when they're used longer than necessary without considering the potential long-term implications for heart health. So what can you do if you're currently taking a PPI? First and most importantly, don't stop taking any medication without consulting your doctor. Suddenly discontinuing a PPI can lead to rebound acid production, making your symptoms worse than they were before you started the medication. Instead, work with your healthcare provider to develop a plan that addresses your digestive health while protecting your heart. There are several approaches that might help reduce your dependence on PPIs while still managing acid reflux and protecting your cardiovascular system. Dietary modifications can be incredibly powerful. Certain foods are known to trigger acid production and reflux symptoms. Common culprits include spicy foods, citrus fruits, tomatoes, chocolate, caffeine, and alcohol. But here's what many people don't realize. The timing and size of your meals can be just as important as what you eat. Eating smaller, more frequent meals rather than 3 large meals can significantly reduce the burden on your digestive system. Think of your stomach like a washing machine. If you overfill it, it can't function efficiently, and things start to back up. When you eat smaller portions, your stomach can process food more effectively, reducing the likelihood of acid reflux. The timing of your last meal is also crucial. Lying down within 3 hours of eating is like trying to pour water uphill. Gravity works against you, making it easier for stomach acid to travel back up into your esophagus. Try to finish eating at least 3 hours before bedtime, and consider elevating the head of your bed by 6 to 8 inches to help gravity keep stomach contents where they belong. Certain foods can actually help strengthen the lower esophageal sphincter, the muscle that acts like a door between your stomach and esophagus. Ginger, for example, has natural anti-inflammatory properties and can help improve digestion. A small piece of fresh ginger steeped in hot water can be soothing after meals. Oatmeal is another ally. It's not acidic, it absorbs excess stomach acid, and it provides fiber that supports overall digestive health. Bananas are particularly interesting. They're naturally antacid and can help coat the esophageal lining, providing relief from acid irritation. Green vegetables like broccoli, asparagus, and green beans are alkaline in nature and can help neutralize stomach acid naturally. Think of these foods as your body's natural fire extinguishers. Stress management is another crucial piece of the puzzle that's often overlooked. Chronic stress can increase stomach acid production and make reflux symptoms worse. It can also negatively impact your heart health through multiple pathways. When you're stressed, your body produces cortisol and adrenaline, hormones that can increase blood pressure, heart rate, and inflammation throughout your body. Simple stress reduction techniques can have profound effects on both your digestive and cardiovascular health. Deep breathing exercises, for instance, activate your parasympathetic nervous system, which is responsible for the rest and digest response. When this system is activated, your heart rate slows, your blood pressure decreases, and your digestive system functions more efficiently. Try this simple technique. Breathe in slowly through your nose for 4 counts, hold for 4 counts, then exhale slowly through your mouth for 6 counts. Repeat this cycle for just 5 minutes, and you'll likely notice a sense of calm that benefits both your stomach and your heart. Regular, gentle exercise can also help reduce acid reflux symptoms while strengthening your cardiovascular system. Walking after meals, for example, can help speed digestion and reduce the likelihood of acid reflux. It also helps lower blood sugar, reduce blood pressure, and strengthen your heart muscle. Think of post-meal walking as a gentle massage for your digestive system. Weight management plays a significant role in both acid reflux and heart health. Excess weight, particularly around the midsection, can put pressure on your stomach, forcing acid up into your esophagus. This same excess weight puts additional strain on your heart, forcing it to work harder to pump blood throughout your body. But here's where I want to address a common misconception. You don't need to achieve some ideal body weight to see benefits. Even modest weight loss, as little as 5 to 10 pounds, can significantly reduce acid reflux symptoms and improve heart health markers. Think of it as removing a few heavy books from a backpack you're carrying all day. Every pound matters. Your engine never rests. It beats about 100,000 times a day and moves 2,000 gallons of blood. Now imagine a fuel additive that makes one area run smoother, but slowly causes microscopic damage to the engine. Would you want to know? That's the story with proton pump inhibitors, or PPIs, omeprazole, esomeprazole, lansoprazole, pantoprazole. Forget the brand name. What matters is what they do and what they might be doing to your heart without you noticing. Why worry? PPIs are among the most prescribed drugs. In the US, over 15 million people take them regularly, most over 50. They were designed for short-term use, 8 to 12 weeks, yet studies show up to 70% stay on them for a year or more. Your stomach acid is your home security system. Defends against bacteria and helps you absorb nutrients. Turn it down for too long and you trigger a cascade. The heart becomes collateral damage. The danger is silent, not a nausea-type side effect. More like termites quietly eating your home's foundation. Months and years pass until there's preventable structural damage. Mechanisms? First, endothelial dysfunction. The endothelium, your vessel's smooth inner lining, like the inside of a hose, when impaired, inflames, slows flow, and raises clot risk. PPIs may interfere with nitric oxide, the molecule that keeps vessels flexible. Less. No. Stiffer vessels, higher pressure, and a harder working heart. It's pushing water through a rigid hose. Second, nutrient absorption. Magnesium is essential for heart rhythm. Long-term acid suppression can lower magnesium absorption, linked to arrhythmias, weakness, even sudden events. B12 also needs stomach acid. Low B12 can raise homocysteine. Think of it as rust in your cardiovascular pipes, tied to higher heart and stroke risk. A story. Robert, 67, retired teacher, fatigue and occasional chest discomfort. He'd been on a PPI for over 3 years. It worked, so he never questioned it. Labs, low magnesium, borderline B12. EKG, not life-threatening, but off. We coordinated a gradual taper with his GI and adjusted diet. Result, more energy, normalized rhythm, nutrients back in range. Keynote. I'm not saying everyone stop your PPI. For serious cases, they can be life-saving. I am saying, if you've been on one for months or years, talk to your doctor. Ask if you still need it and what safer alternatives might look like. Many people don't even realize they're long-term users. It becomes routine. Treat your meds like car maintenance, oil, tires, systems. Evidence has linked prolonged PPI use to higher cardiovascular risk. One large study, 16 plus people, found a 16 to 21% higher heart attack risk versus non-users, and others suggest stroke links. What troubles me most? Much of this risk may be reduced with monitoring, reassessment, and alternatives when appropriate. The tragedy isn't PPIs, it's using them longer than necessary without watching the heart. If you're on a PPI, do not stop cold turkey. Rebound acid can hit hard. Make a plan with your clinician. Ways to reduce dependence while protecting gut plus heart. Identify triggers: spicy foods, citrus, tomatoes, chocolate, caffeine, alcohol. Portions and timing: smaller, more frequent meals. Finish eating 3 hours before bed. Elevate the head of your bed 6 to 8 inches. Food allies: ginger tea after meals, oatmeal, bananas, green veggies, broccoli, asparagus, green beans. Your natural fire extinguishers. Stress: activate rest and digest with a 4 to 4-6 breath. Inhale 4, hold 4, exhale 6 for 5 minutes daily. Movement: a 10 to 15-minute walk after meals aids digestion, lowers glucose, and supports your heart. Weight: losing just 5 to 10 pounds can ease reflux and improve heart markers. Hydration: drink mainly between meals so you don't dilute stomach acid. Sleep: left side sleeping and a raised headboard help keep acid down. Nutrients that help: always discuss with your clinician. Probiotics: yogurt with live cultures, kefir, sauerkraut, kimchi, and prebiotics: garlic, onions, leeks, asparagus, bananas, oats. Magnesium: leafy greens, nuts, seeds, whole grains, dark chocolate. B12, fish, meat, eggs, dairy, and if needed, supplementation. Omega-3s, salmon, mackerel, sardines, walnuts, flax, chia. Practical plan starting today. Keep a food plus symptom diary for 1 to 2 weeks to spot patterns. The 3-hour rule before lying down. 5 to 6 smaller meals instead of 3 big ones. A short post-meal walk. 5 minutes daily of 4-4-6 breathing. Sleep hygiene: cool, dark, quiet room. No screens. 1 hour before bed. Hydrate between meals. Crucial step: schedule a medication review. Ask: how long have I been on this? Do I still need it? What are my alternatives? What does a gradual taper look like? Share your heart risk factors, family history, symptoms, and all med supplements. If you must continue, ask for monitoring, serum magnesium and B12, plus an annual cardiovascular check-in. Medication choices are individual. The PPI heart connection is still evolving. That's why staying informed and talking with your doctor is power. Final message: this isn't fear, it's empowerment. Small, consistent changes can transform your gut and your heart at any age. Share this with someone who needs it and pick one small change this week. Schedule that review, adopt the 3-hour rule, or take a post-dinner walk. You're not chasing perfection, just consistency. Your heart has carried you this far. Give it the care it deserves today to win all the tomorrows ahead.